This is the Barbell Therapy and Performance Podcast, where traditional healthcare is redefined to help listeners achieve peak performance, accelerate recovery, and elevate overall health. Hosted by Dr. Brett Scott, a doctor of physical therapy and national strength coach, this podcast explores the worlds of fitness, alternative medicine, and holistic health. Each episode uncovers innovative strategies and practical solutions for those seeking to enhance their quality of life when conventional methods fall short. It is our firm belief that every living thing has potential, and it is our mission to help you find that potential.
All right, guys, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott, and with me here today is Jess Ferrer, and she is a licensed massage therapist by trade, but is also a certified personal trainer. She teaches yoga and Pilates. She's got a history in circus arts as an instructor there, and she's got over 20 years of experience integrating all these different things with manual therapy. And so I wanted to have Jess on here today because for me and our patients, we get a lot of people that want to get massage or they've been to massage therapy, and most of the time it's something that has temporarily helped them get better, but has never been the end-all be-all of their issues that they've been dealing with. And I think there's a lot of reasons for that. And so part of my job is what I want to do is make sure people aren't wasting their time and money, and really getting a better understanding of what massage is, what it isn't, when we should use it, when we shouldn't use it. And I think Jess here is someone that can kind of play both sides of the ball, and as a massage therapist knows a whole lot about massage, but also integrates it with a lot of other things because she knows it's not that we can just make everything a nail and just use a hammer for everything. There's different tools in the toolbox we need to have. So Jess, thanks for coming on today. And so for you, I mean, what would you say massage is, or what people think of when they hear massage?
Thanks, Brett, for having me on. Let's see, massage, what the average person thinks it is, it's such a range. It could include just a spa visit, a relaxation thing, a thing to do with your girlfriends. And then you have the other end of the spectrum where it is integrative with conventional medicine, therapies, and even facilitating function and movement, just the same as anything within conventional medicine. But it's in the cracks of in between. It could be conventional depending on the therapist's knowledge base and approach, and then the whole other end of the spectrum. And I actually lean more towards how does it help our population get better. And most of the people that come to see me come from, having seen conventional medicine, PTs, OTs, all the doctors, all the specialties, and then sprinkled in between, like all the holistic approaches as well. So that's where I'm coming from.
And so for you and me, there's a lot of people out there that think massage is just rubbing muscles and releasing scar tissue and adhesions. And unfortunately, there's still people out there that are working in this field that say these things. So what do you have to say to that?
That is only a small part. Those are things that can be addressed with massage therapy, but overall, it's a whole body. If we look at the majority of massage therapists out there, it's a whole body approach, hands-on manual approach to therapy with a range of modalities that we all uniquely train in to help facilitate the client's their body's ability to maintain, restore, improve function and movement in their daily lives to make it as best as possible for wherever they're at.
Mm-hmm. And so with that being said, so you're saying, because the big thing, the data we have now shows that we can't break up scar tissue. We can't remove adhesions from tissue, right? So
Right.
there's a lot of studies that show it's like, okay, it takes 1,000 pounds of pressure per square inch to make a deformative change to something like the IT band. So when we're looking from a massage therapist point of view, what would you say the best thing we can tell our clients is of why we're making change to tissue, or how we're making change to tissue?
Well, coming from my approach and, my knowledge base, let's go back to what I just said, is facilitating the client's body's ability to make change. So even from a neurological standpoint, when you put a hand on a client's body, something happens, even if it's an exchange of heat and the body's responding neurologically. Maybe there's an emotion that comes with that, or a settlement of pain is a neurological response just from the contact of touch. We're affecting change. And from those things, the brain controls a lot. The brain can start to repattern, whether it goes into fight or flight, or it's like, ooh, this is very relaxing and soothing and calming, and I could turn my volume down on the pain. That's already made a change. And then it kind of branches off from there. And I'm not saying that we don't have to apply pressure or techniques or any of that, but any level of touch, and that's what a lot of people in the field of massage therapy, it's about being able to touch appropriately when appropriate and how and why. Let's start with when a client comes in, why are they there? Why are they coming to see me? What have they already tried, or who are they already currently seeing? What's going on with their body? And I mean, somebody could come in and say, yeah, I have back pain. And then I'll say, well, what do you want me to address first? And they say, well, I've had this raging migraine. Well, then even though they may have started in with complaining about this longstanding back pain, what I got to look at first priority for them, because it's highlighted, is maybe their migraine and what's affecting that. And it might be playing into the main chronic issue. So it's a whole ball of wax.
Mm-hmm. And there is still something we're doing at the level of the tissue, though, for the patients too, right? So we're getting more hydration.
Yes.
We are creating some type of, we can create synovial fluid exchanges within or around joints. So what things are happening?
Increased circulation.
Mm-hmm. Yeah. So just take me through like what things are actually happening at the level of tissue on a physiological perspective.
From a massage therapy point of view, there's the contact, every time I have an intention to make contact with the client's body, whatever part of it is, there's going to be assessment from every second of contact. That could be heat, that could be vibration, that could be watching other signs like increased respiratory rate. All the while I'm trying to start leaning, I call it leaning in to the tissue to address whatever problem. Say it's low back pain, and they sit 90% of their day. So they have a sitting stationary job. They don't necessarily work out, but they're constantly in a hinged position in a chair. So I might be working their quads, checking out their anterior hip flexors, and I'm assessing the quality of the muscle. And it's going to be it's an assessment of their quality of muscle tissue based and relative to them. Because working with a performance athlete, their tissue might feel like butter, and then the areas of tension that present might feel rigid, stiff, and maybe have a certain quality of dehydration, versus like the everyday gen pop person who has a seated job, who's, desk job 5-6 days a week, that doesn't move. Their tissue is not like butter. But I have to evaluate what is the area, the side that they're not complaining about. Say it is the legs. I'm going to check out the quality of all the tissue of the unaffected or uncomplained of leg, and then compare it to the one that seems to be the issue, so that I have a base of reference.
Mm-hmm. And, the other thing is too, it's like, what is the hardest part about being a massage therapist? For me as a PT sometimes, and maybe it's the same, but, and you are more than just a massage therapist too. But I see a lot of people go in and get massages recurrently and kind of chronically for the same thing. And it feels better temporarily, and it doesn't last. So like nutrition, hydration, strength, conditioning, like these are all things that people need to address that maybe they don't want to because they're harder, and massage is easier. Just, I'm going to go lay on a table. I'm going to feel better temporarily. So do you ever feel, maybe not you per se, but some massage therapists feel handicapped of like, I know you could get better if you addressed all these other things in your life too?
What I'm about to say, a bunch of massage therapists are probably not going to like me for saying this, but they do get caught in a loop, or they get caught in a sequence or a pattern, and they just hear back pain. So then they're going to do a certain protocol, and it's almost it's their agenda when they hear a complaint. Instead of working with the client, I say, because I practice as described by some iteratively, where I am always, it might seem repetitive, but I'm always making changes. So from session to session, and there are clients that I've been seeing for almost my entire career, they may have similar complaints. There's always a primary complaint, and aging has a process to that too, or a contributing factor. And also, however, how spaced out they come to see me, and how many other things they do, and maybe they decide to sky jump and then land on their legs. So there's a lot of things that change how they come in. And I always start with, what is your status now? And that is really where I feel anybody who is trying to help somebody be better, whether it's a massage therapist or a PT, we want to meet them where they're at when they come in, because that's the health status that we're going to work from. When people do go to the, I'm going to say, average massage therapist, if their therapist has an agenda of just getting through, it's kind of like an order. You order a burger. You don't know how they make the burger, but they probably make the burger the same way. But if you actually sit down and ask, because you have somebody who has a lot of restrictions, and say, well, you want the burger, but if you can't have nightshades, you can't have this, you start customizing it, and then it is really what works for that person. So when somebody just says, okay, well, their PT will recommend massage, which it offers a lot more time. I think one of the things we have discussed in the past is the difference between a PT massage and what somebody could attain from working with a massage therapist that is, it's their job, is oftentimes what I hear is that when they go to a PT to get massage, there isn't much time. It's about 10, 15 minutes at the most, maybe 5. But it's also, and I'm going to pick this part because you're a PT, but your direct access. When it's under insurance, they're limited to the amount of time that can be spent for that modality. And usually I think it's increments of 5 minutes or 10 minutes or 15. And then it's billed that way. Mm-hmm. But when you come to a massage therapist, oftentimes you can choose the length of time. And there's massage therapists that work with insurance, but because we are and always have been primarily direct access, you pay for the time. Now, when you come to see me, because this is the way my business is modeled, you pay for the time that you are visiting in my office with me, and my evaluation of you, my assessment of you, every single visit starts from the time that I visually see you come in the office, because I'm already assessing and all that stuff and seeing how you come in. And then there's always interview and then education pieces. And sometimes the hands-on is never really going to be for a 1 hour massage, 60 minutes on the table, unless you're walking in naked. But when somebody goes to an average massage therapist and the massage therapist is not really meeting you where you're at, and they're like, okay, low back pain, I know what to do. You are getting a routine. And everybody's pressure scale is different if you're just going there. But it's also the knowledge base of that therapist. I can't speak for everybody. I know what I like to fill my library with and the library in my brain. It helps me provide better therapy, so to speak, to my clients. And I feel comfortable and confident that I can, backed by science and the knowledge and education of what modalities can work, what can't, what I know, what I don't do. I know how to refer out when it's out of my wheelhouse, or helping them find resources to get educated in certain things or more information. But going to any massage therapist, I don't. It's a slippery slope. I mean, there is a full range of people who are calling themselves a massage therapist.
Yeah. Same with personal trainers and PTs alike too. Yeah. So my question to you is, in school for massage therapists, how much time is spent on assessment?
Depends on the school.
Okay.
Depends on the school. There is, for every state has a certain minimum requirement that meets accreditation for massage schools that pop up and exist in the country. My program was unique in that it was 900 hours, and it was very thorough. It included mental health component on therapeutic relations. So we understood how to work with clients when they come up, and even the mental
building
health aspect
trust.
of being a therapist. Building trust and actually, working on yourself, how important self-care is for the therapist, because you may be working with somebody and something like, I'll
anxiety,
use this as an example.
Anxiety, depression.
Anxiety, or somebody who is a senior, like over 70, comes in, and that might trigger a memory for a therapist, and they might be so wrapped up in their head, and then working with that person just because they remind them of their grandmother can actually create a hiccup or just a block in how to provide objective therapy to that person. But I mean, every program is different. Assessment, I know a few that do spend a lot in orthopedic assessment, at least educating them on what it looks like, what it does, actually teach them how to do it. Whether or not the therapist graduating for those programs that do provide that education, implement those, is kind of, you don't know until you get there.
Gotcha.
As far as the national certification exam that massage therapists have to complete in order to get licensed across the country, that is usually required by a lot of state licensure boards. I believe it doesn't ask those things, like what is this test and what's that test, and how, what assessment tools would you use? Usually it is like, most people would just walk in, and it's going to be all subjective. So whatever information you give as a client, or none, that's what they're going to go off of. Unless, like me, I ask a ton of questions. My intake form is about 5 pages long, and most people will say, wow, this is like a Bible. Like, you're asking a lot of information, which a lot of people don't think, why am I giving you all this information? Because you're just a massage therapist. But it's all relevant, because even though they might just think that it's it's muscle pain, sometimes I could find and assess with my hands and movement and, passive movement, range of motion limitations and such, that along with some of the pathological conditions that they have, some of their muscular issues are not because of their muscles. It's because of the other things going on. And coming to a massage therapist, that is an example of why at that moment, massage may not be appropriate.
Yeah. And so when would you say massage isn't appropriate? Because I can think of plenty of times when it's not appropriate. And this is the question you really wanted to answer here, I think.
Partly. If somebody is in an active, if within 6 months of somebody being hospitalized for anything cardiac,
Okay.
outside the post-op protocol provided by a physician surgeon. So, now I know you do a lot of orthopedic PT, and I'm sure you've seen your fair share of post-op stuff, especially joint replacements. Two patients can go to the same surgeon and they'll still come out and they'll get the same appliance for a hip replacement, same exact type of appliance, and the surgeries have a little difference between the two of them, and the post-op protocol and how they should treat their new hip is going to be different. So a knowledgeable massage therapist would ask to have a copy of that if they're going to be seeing them. Also, probably medical clearance, a note from their doctor. And like for me, I would ask permission to communicate with their healthcare team that they're actively being followed, especially if they hadn't had their first follow-up. Or their physical therapy, physical therapist they're currently working with, so that there isn't overlap or contradiction. And maybe sometimes, partnering up with the physical therapy team, if they can't get to doing a certain thing within the certain time frame of the visit, and it's something that they could just simply ask, hey, can you possibly do this the next time you see Mary? Then I could say yes or no. So it's just open communication to, again, facilitate and improve the wellness of the patient.
Speaking of improving wellness of a patient, so for me, I got a 90-minute massage a few months ago. It was like a gift. And again, that's why I was asking about assessment too, because I've only gotten massages. They've been like gifted to me, because basically my mother goes regularly because she doesn't want to work out and she feels pain and she doesn't want to listen to her son that's a PT. Sorry, Mom. But like I'd be all stressed out. She's like, here, go take my massage or whatever. So I got one, and it was a 90-minute one, and like it felt good and everything. It didn't hurt. Like she used an adequate amount of pressure, which I also want to talk about too. But I don't get them regularly, and I don't know what it is, and I hope you can tell me maybe. I was sore for like a week, and not even just sore. My workouts were like crippled for like a week. Like my nervous system was just like done. Like I could not push any type of weight for like a week. And I was like, is this all just from the massage? Like what happened to me there?
Well, I'm going to ask you this first. Why do you think it came from the massage? Because it was the last thing you had done?
Yeah. I mean, there was a correlation between like, I was sore for like 2 days after. So I think I'm not blaming the massage directly, but maybe it was something with my nervous system, like down regulating out of like sympathetic to parasympathetic nervous system activity. Cause I'm not good at relaxing usually. And maybe that was the first time I figured out what that was.
Well, one of the things would be, and you don't have to say it here if you know, but, I'd be curious to know what your experience was like, neurologically, like what was coming up. Sometimes, like, I'll use this as an example. People will come and they're like, yeah, I need this. Just like going to the gym. I need this. Yep. But they're really not ready for it. They don't mentally, they're not in the headspace to receive it, and they're guarded. And in an initial, like, if this was the first time, if you're going in to to a massage therapist for the first time and you're guarded and they don't know because it's the first time that they've seen you, and they start to work on you, like they do feel the rigidity, but they have no idea that this is you guarded.
Yeah. Baseline.
And then they're working with that and you don't know, or and you're not communicating it. Or just not body aware, or, sometimes clients might even check out because they're like, yep, I'm only doing this because I got a gift certificate. And if I don't use it because it expires next week, they're going to kill me that I just wasted it. There's a lot of those mental factors that play into it. And then because it is more or less like the basic massage therapy session is a circulatory thing and a nervous system, either it tonifies or it upticks it. Depends on also the technique she used. I would even wonder which direction she went as far as the strokes. Because there is research out there that if more downstrokes, and it has nothing to do with, pushing the blood towards the heart, all the strokes need to go towards the heart. That's not even really a thing anymore, unless that's the intention. If we make technique movements away from the brain, down the spine, towards the fingertips, down like away to the lateral, from medial to lateral, it calms the system down.
Okay.
And everything stimulating is up towards the brain. So it depends on her technique too. And maybe even where she worked.
I was wondering too, like from a physiology standpoint, could it just be like there was a lot of metabolic damage built up and we just put it back into circulation? My body was sore for a week. That's
the other part. If you had, and we're not going to say lactic acid, it's metabolic waste. It depends on what you did previous to the massage. Even your in nutrition, as we kind of touched on that a little bit, your nutrition or lack thereof, if you were just like starving yourself, or taking in other things like supplements can also, like, camping out, the components of supplements can be just sitting because they need more engagement of the body. And then you have somebody you're lying on a table passively, and you have a massage therapist more or less putting your body through a passive workout. You can feel sore. Like I've said that to some of my clients. Like if they're a sedentary individual and I'm doing something full body, total body, and they're asking for, like, I don't really move and I want more movement. And sometimes that will involve some vigorous massage techniques to open up the range of motion for their joints. I tell them they're going to feel sore like they worked out for 2 days. And if it goes beyond 2 days, then it was too much for their system. Not too much pressure, just too much, maybe a little overwhelming. Kind of being drunk on massage.
Yeah. And speaking of that too, so pressure is another big thing I wanted to talk about. Of, all my meatballs that I train and everything, my bodybuilders, CrossFitters, whatever, they just want you to dig in so fucking hard. And it's like, so this is a 2-part thing though, too, because we know scientifically that the mechanoreceptors for muscle tissue, most of them lie superficially right under the skin. So it doesn't take a whole lot to stimulate a response or a change in most people, where we can improve mobility, improve muscle tissue extensibility, yada, yada. Right. But people don't feel that. They want to feel something, right? They want to feel like they got to work out, although we don't need to. Now there's a whole bunch of things to that too, with patient preference and patient outcomes based on their preference. So like if they don't feel like they got enough pressure, they're probably not going to think that the massage did anything. Therefore their outcome is kind of a wash. Right. But the thing I want to get across, it's like, I just need someone to like re-verify this for me here. If you're whether you're on a table, whether you're using a lacrosse ball, you have I used to be at a gym. We called it the ex-wife. It was this big, like, titanium steel rod. That Donnie Thompson. Do you know Donnie Thompson? Body tempering. Body tempering is basically take this like 100-pound steel rod and roll it on your quad and make it feel better. Yeah, that's the thing.
Okay.
But it's like, we don't need to do that. I remember I took a course and it was all about like getting away from that because we don't necessarily need it. It was like the instructor basically took a Graston tool and it felt like there was a cat just licking me on my neck, slow and just steady, like not much pressure. And, rapid changes in range of motion. I was like, that's weird. Okay. Like it says something. So you can go harder. And I think there are people that are kind of neurally dense where they don't respond until they get some deeper level of pressure. But you shouldn't be, and correct me if I'm wrong here, but like you wincing on the table when your toes and fingers are curling up and your shoulders are raising and you can't breathe. We're not doing anything there that's helping us relax any bit more. We're actually jacking the nervous system up more.
Exactly. But all of that you just described, what do you think is happening? Is all you're contracting. So you're zeroing out exactly what you're creating, more of a barrier. So you're building a wall ahead of actually receiving what you may need. You're right. A lot of research is finding that a lot of things that helps our body change is at the superficial layer. We don't necessarily need to drive so deep that we're at the bone. We also have to be mindful of the tissue that we are affecting. So how much poundage and the quality of the person's muscle, and is it in an area that we're going to be smashing a nerve? Sometimes that want and that, quote, their perceived need to have the shit kicked out of them is a need for that endorphin rush, just like the high of winning a competition. It's practically, I would say, biochemically the same thing. But there are individuals that do, like you mentioned, do need that deeper pressure to have change affected because of the way their physiology, their makeup is. And you had touched on a while ago, we kind of had a brush with this, and it is a whole nother topic that could be discussed in it's its own podcast, is hypermobile people. And there are various, there's a whole spectrum of hypermobility at the deepest root. And don't absolutely just say, yep, Jess said this, and this is, the law or whatever. Hypermobility often has that component of the deeper connective tissue around the joint that is compromised in some way. And then the body's reliant on the muscle tissue, which is the external, the bigger structures, to provide the stability. And when that's the case, you got, you don't have the internal, you don't have the I-beam holding the house up. You have the external drywall trying to hold up the house. And, those people have to learn a different way of finding stability. And sometimes, for hypermobile, I'm not going to get into this because this is going down another rabbit hole, is hypermobile, people who have hypermobility and connective tissue disorders need specialists in the field of massage therapy if they're going to want to include a massage therapist. They need people who are knowledgeable in those conditions because there is a lot of times that certain massage modalities, applied pressure and techniques should not be implemented with those types of individuals. Because taking away their stability, because taking away their stability because their muscles are trying to make up doing the job that doesn't exist at the deepest core level closest to the joints, and that's just one type of hypermobility. It's going to cripple them, and it's going to make them more at risk for injury. Even just getting up off your table could not be a good thing once somebody is hammered so thoroughly into their body, not understanding what that pathology really is, or what it is to that individual. So, and then also being knowledgeable to be able to identify signs and symptoms that, a lot of clients don't. This isn't I wouldn't say it's a new thing. It's just newly surfacing into mainstream that hypermobility is a condition of connective tissue disorders. There's testing, but it's not something that is commonly tested for right when you're born.
Yeah.
People find this out years later.
So are you talking about just people that have like general hypermobility, or are you talking about someone that has like an Ehlers-Danlos syndrome or like true connective tissue disorder like that?
All of it. Because even somebody
like a gymnast, an average gymnast, you're saying could.
Yes.
Yeah. Okay.
Yes.
So take that gymnast, right? So, every gymnast that I know thinks they have tight hamstrings and tight hip flexors. And we know they're not. Well, here's the thing. The hamstrings and hip flexors can feel tight. I understand that they can feel that way, but that is just a sensation. That is not a state of being, right? Now, the problem we face, I think clinically, and something I've thought about more recently too, is the context of which we test in makes it hard to say yes or no to some of these things because, you have patient preference too, but if I lie you on the table, right, you're flat, there's no control, you don't have to do anything, and I put you in what we call a Thomas test, and okay, yeah, negative, like you don't have tight hip flexors. But what happens in standing? What happens if I put you in a crawl position or a half kneeling position, or I throw some demand at the upper and lower quadrants all at the same time, or have you do some high level skill? We don't know contextually there if the hip flexor is actually hypertonic or not, or if there is more demand placed on it. So that's kind of the hard part of some of these things. So as a massage therapist, what is your viewpoint on performing massage on something like a psoas where maybe it's presenting as a tendinopathy symptom-wise, but it tests that it's strong enough and it's mobile enough. What are your thoughts on that?
I actually do more visual, postural, and functional testing. I don't put names to it. I just, as a gymnast. All right, let's talk about the gymnast here. I would actually look at what her posture, her natural standing posture, her casual, and where things actually lie. Where is it a where does the pelvis tilt? How straight or the curves of the spine, where's the position of the neck, where are the shoulders, how much tone is she locking her knees all the time? Is it, hyperextended where there's a lot for me, at least as a massage therapist, when somebody comes to see me, I look at all those things. And also, if we're talking about like a school age kid, also like how does she carry her things to and from school? The active posture stuff. Yes, I'd ask her for her active range of motion and have her or him show me their flexibility and watch how the body compensates to some of those things, because I don't just, even though the complaint is at one joint like area, there's other things that start moving.
Yeah. So let's say we have one finding here, right? Everything is normal. And let's go with hamstring just to make it a little less complicated, I guess. passively, more than enough range.
Mhm.
Actively, they're limited. They can't do a straight leg raise, past 70 degrees to save their life, which is basically adequate, right? So say we're missing 50 degrees from active and passive range of motion.
Okay.
Would you do any type of massage on that tissue to facilitate it in some way, or would you just leave it alone? And
I
why?
would slightly palpate it with it, not so much actively massage it. It would be more of a palpate and see okay, let's see where the quads are. Are the heads working as one unit because they're all stuck together? Or core engagement. The other part to it, which is not within my scope of practice, nor it's an area that I would ever want to. I mean, it's the PT thing, is pelvic floor health.
Yeah.
And I do have a lot of clients that come to see me, and I'll palpate their areas that they think are a complaint, like anterior hip and hamstrings, or even back pain. And I'm like, the tissue is just fine. Like, it's equal across the board. I wouldn't do massage on that, and I would ask secondary and tertiary questions that may seem more intimate.
Yep.
But also make a referral to the appropriate physicians that cover those areas, and inform the client, because they're coming to me for that muscular issue, and I'm knowledgeable in the muscular aspect of pelvic floor. I might do some education in my office, because I can't guarantee that they're going to get that from the other professionals right off the bat, but so they understand it may be muscular, and this is why I'm thinking that I need to refer you out. If these are the muscles and here they are, and you are telling me you have problems peeing, or pain with pooping, or pain
with sex, hemorrhoids.
Yes, exactly. Yeah. That even
it's another
trying
issue.
another issue that is not something that's in my scope, and these are the specialists that you may need to see, and this is probably where these are the people that can do direct work, and that would be a pelvic floor specialist in physical therapy.
Yes, not just a physical therapist. Don't come to me with these issues.
Not just any PT, but yeah. I've even said, well, it's not me saying, but I've had a client who I actually did a phone consult, and they were referred to me by another colleague of mine who does the same work, and it was low back pain, and her client called me and said, I don't know why she's sending me to you, but apparently she's done what she could. And I said, okay, so it's back pain and she's done what she could. I don't think there's anything more. So I asked her those next level questions, and I told her, it sounds like you have pelvic floor issues with the muscles of your pelvic floor. And she said, well, you're a massage therapist. Can't you do it? She trusts you. I trust you. I'll let you do it. And I said, absolutely not. Out of my scope. I don't have a license to it, and not an area that I want to get involved with.
Yeah. I don't know if I want to tell people what pelvic floor therapy always endures either.
There's things that there is approaches that don't involve intrapelvic anything, and that is not limited to women. I'll just make that very clear.
Too. Yes.
Men too.
I've sent some men for some pelvic floor issues, because men, and so that's the thing too, is men have these same issues. And people don't realize it's like pelvic floor. It's like, yeah, you have muscles and tissues and tendons. Like, they can get overstretched, overworked. They can be hypertonic. They can be weak. They can do all these things.
They could also develop trigger points secondary to external issues that weren't addressed, such as psoas issues and iliacus issues and hip issues that were not addressed, or could not get treated, and then they become more of an issue, and the body decides that they're going to tighten up everything else and lock down.
Yep.
So yeah,
I sent a patient a while ago, and he came back, and he was not pleased at the type of massage he received, but he did get better. So, man, put your ego away if you need to do it. And I think the other thing too is, like, this just brings up a good thing. We just made an Instagram post about this too, of like, don't be afraid to tell your provider these things that are going on. Like, we hear them all the time. Every single back pain patient I have that comes in, I ask about your poop, your pee, your sex life, in very like,
Exactly.
does it hurt or not? And yeah, plenty of other questions. Do you
It's
have
totally clinical. It's not personal.
No,
it just helps us. It helps us understand, and it gives us verbiage that helps you understand what we're trying to ask you versus, hey, how's your, your deeper tendons and ligaments down, low.
Yeah. So, and the thing is too, it's like people don't realize with anything too, and this is where like questions and interviewing and stuff is really important, is if you don't tell us these things, and this is kind of my problem with some massage therapy clinics or spas or whatever, is like you just go in and lay on a table. It's like my shoulder hurts. It's like, all right, let me hammer it. Where it's like, well, you didn't look at my thoracic spine or how that rotates or my head rotates or like when and why it like active versus passive, all these different pieces. Like, is there motor control stability? She's like, no, just lie on the table and I'll take care of it. It's like, okay. But if you have these underlying things, especially with pelvic floor going on, like we can hammer your back all you want. We can dry needle it. We can manipulate it. We can do all these things. But yeah, I'm not looking down there to see what's going on. I can only ask questions and refer out. But if you don't tell me these things and you want to hide it because you're embarrassed, you're going to waste your time with us sometimes.
Right.
And it's like, 5 weeks in, it's like, hey, you're not getting better. It's like, do you have anything else to tell me? It's like, oh, actually, yeah, like this is a problem. It's like, okay, well,
right.
I can't really help you with that. You need to go somewhere else.
Exactly. And we're not trying to get rid of you. We're trying to get you the right professional that can address it more directly than we can.
Yeah. And I tell my patients all the time, I love money. I will gladly keep treating you as long as we have the same, we're on the same page, that the expectation of like, some people just like coming in because it's an hour away from their kids or whatever. And it's like,
exactly.
Right. But we're not trying to fire you because we just want to make sure you get what you need.
I often, and I know massage therapists all hear it, it's like, well, I don't know what's going on. I'll ask, like, what's going on today? They're like, I don't know, but you'll find something. Mm-hmm. And, well, then they know that they're going to go, I'm going to put them through the eval process, and I might have them do a couple of moves and watch their mobility. That's why I know you one of the things is frequency of massage sessions. There are pluses and minuses. Sometimes there is such a thing as too much massage, really, for various reasons. What I like to tell my clients, if I see you, I hope I'm doing such a good job that I don't see you that often for the same thing. There may be instances where they're limited on time and they only have half an hour and I can't really address, but I'm going to pick the most important things for a half hour to address. But I might have them come in 2 days later because, well, I could show you how to tape. We could do this by video. I need to tape your knee, but you need to get the swelling down on this and blah, 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 whatever, kind of. They want to put it in parts, and the only time they can come in is short bursts, then that's what we're going to do. And you're going to come in a little bit more frequently, but I try to taper people off if it's just for the same problem. But there are people who they do so much, they try to stay active, and there's always something coming up. And every time that they come in, what's going on? How are you doing? I mean, it sounds like a casual conversation, but I'm really looking for what's the story today? And what's going on. Like you should be aware of your body. You might not be very good at being body aware, but you should have an idea of how you're feeling, because you should have a better sense of feeling, after a session of anything, you should feel better.
Mm-hmm. All right. And do I have anything else here? I think that was about it. I think the last thing I wanted to just throw out there, Jess, is so I guess it's like we said, like we don't want to just send you to a massage therapist that's working at like an Elements massage where it's just come in, get on the table, leave. Like, what should people be looking for and finding if they go get a massage?
I'll start with this. Depending on what it is that you're looking to accomplish with a massage therapist, like why are you going there? And what are you looking to get out of it, out of the session? If you're an athlete, I'm going to say this, and please hear me. You want to make sure you're going to see somebody who can understand the athletic mindset and the actively engaged body, like an athlete's body. I have had clients come from out of state, like drive all the way from New York City to see me in my New Hampshire office, all because they had a procedure and they were a junior hockey player, collegiate hockey player, drove all the way. He had a hip procedure done by I'll say general population orthopedic surgeon, and it wasn't with a sports focused orthopedic surgeon. And the procedure that was done was not appropriate for a performance athlete. And he thought that I could do something to fix it externally. Mm-hmm. I explained to him what I could have done, but given whatever was done internally to the hip, that was it. That's all the range you got, like based on the procedure. But I reminded him and I referred him to other athletic-based performance orthopedic massage therapists closer into New York City. Like, go see these people because they will understand your schedule, your demands on your body, training schedule, when to rest, when to, make sure to kick your ass to rest and make changes, and how to work with your athletic coaches and strength and conditioning people. And also have access to the modalities that help you with recovery and improved performance. If you're an orthopedic, like you just had joint replacements, if you're a senior, there are massage therapists that specialize in geriatric. I don't want to use that word, but people who have more life experience. And there are things that the aging process does to the body that make it completely different. It requires a different approach. I'm not saying that you have to be feathered and that's the only type of massage that you'll ever get when you're a senior. I had a senior who was like still black double diamond skiing in Austria. He was like a bird of a different kind at the retirement community, and he wanted deep tissue, and that's all he's ever gotten. And we discussed all his medical conditions, and I said, but there's nothing that tells me that I can't do the pressure or the style or the techniques that you want. But if they presented with a condition that says, nope, you can't work the upper quadrant with any kind of moderate pressure of more than 5 grams, then I'd explain why. And they could decide whether or not to continue with pursuing me, working with me as massage therapist. And usually that's the case, is that I am telling them the reason why I'm doing it and why I can't do it is for your safety and for your health. And that's what you need to find in a massage therapist.
Certainly. All right, Jess, and where can people find you? Where do you work out of, and where can people find you on social media and email and whatnot?
I have 2 locations where I currently practice. I have a practice in Winchester, Massachusetts, and the second location is Amherst, New Hampshire. My website is physiotherapyboston.com, all one word. And I have a Facebook page. It's Jessica N. Ferrer, LMT at Physiotherapy Boston. And I think my Instagram is still my personal page, but you could still look me up there. I also have, as Brett mentioned, I did teach aerial circus arts for a time, including aerial conditioning. And that you could also find on Facebook and Instagram, Cirque Body LLC, CIRQUE BODY LLC.
Awesome. Thank you so much for coming on today, Jess. We really appreciate it. And hopefully we'll be able to have you on again at some point.
Absolutely. Thanks, Brett.
No problem. Take care.
You too.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram or visit ARKITECTFitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.